Hello everyone and welcome to another CBCLIPS. In this CBCLIPS episode, I present you with a 4-month-old baby boy known to have a prenatal diagnosis of a lung lesion, and I show you the CT scan at 4 months of age, and I tell you that he's been asymptomatic. First question is, what is the lesion? The lesion is a hybrid CPAM because we're seeing a cystic lung lesion with a systemic arterial blood supply. So this is not a simple sequestration. Now, we know that there's significant controversy about how to treat asymptomatic CPAMs. One camp of surgeons believes that these lesions should be resected, that there's a significant risk of infection, and once infection develops, resection may be more complex. We also believe that there is a, if small, but finite chance of malignancy early on, as in a pleuropulmonary blastoma within a CPAM or confused with a CPAM, and later degeneration into malignancy, again, rare, but some aggressive malignancies have been reported much later in life. The camp of surgeons who believes in observation cite the fact that patients can be observed and then resected afterwards if they become symptomatic, and there is some literature to show that resection after symptoms is not that much more complex, and they also mention that malignancy is extremely low, the risk is very low, and that most of these patients will lose some normal lung tissue along with the CPAM. One thing that does not emerge in this debate is that I have noted anecdotally that there are many patients who seem to be asymptomatic, and then when you go in to resect them years later, they actually have significant inflammation. And I show you a picture here of a 4-year-old girl with significant vascularized adhesions and inflammation of the chest, even though she was not symptomatic. I think the important thing here, given all of that, is that this is a shared decision-making, a perfect example of how a shared decision-making can be with the parents. My recommendation is to resect. I typically resect them between 6 and 9 months of life, and this video shows you the resection in this patient. I want to take a moment to pay tribute to Dr. Steven Rothenberg, who has done tremendous work to bring us the minimally invasive treatment of these patients, and we really owe a lot of the great outcomes to his innovativeness. Thank you. Until another CBCLIPS.